The Doctor's Journal is brought to you by O Snacks and Medical Associates Hospital.
Can you think back to your favorite memory? Try to picture it in your mind.
I'm sure you remember the who, the what, the where, and even the when. Now imagine if this memory was totally erased. Scary, right?
Very. This is a reality faced by many worldwide who suffer from a debilitating brain disorder.
That's right. And there are over 10 million new cases diagnosed each year. If you do the math, that is about one case every 3.2 seconds.
Today, we look into dementia and its life-altering effects.
Welcome to the Doctor's Journal, where we unpack many health threats facing us today. Hi, I'm Dr. Mike.
And I'm Dr. Sunrain. Today, we look at a very serious condition that affects millions of people globally, dementia. In fact, 2020 records showed 55 million people living with dementia worldwide, which means you or someone you know suffers from one or multiple types of dementia.
That's very true, especially here in the Caribbean. Research suggests this number will almost double every 20 years, reaching 78 million in 2030. What we also cannot ignore is the financial weight of this condition. Just imagine the total estimated worldwide cost of dementia was US $818 billion in 2015.
The annual global cost of dementia is now above US 1.3 trillion and is expected to rise to US 2.8 trillion by 2030.
That's a lot of money, Dr. Sunarayan. Now, the term dementia covers a cross-section of brain disorders which affect memory, thinking, behavior, and emotion. And it is the leading cause of disability and dependency among the elderly populace.
It is important to note that each person experiences dementia in their own way, but generally those affected eventually need help with all aspects of their daily life.
Now, there are different types of dementia. We have Alzheimer's disease, the most common, frontotemporal dementia, Lewy body dementia, and vascular dementia. Each are characterized by the biological evidence present in the patient. Although Alzheimer's is the most common cause or form of dementia, today we are going to take a closer look at vascular dementia.
Vascular dementia refers to changes in a patient's memory, thinking, and behavior resulting from conditions that affect the blood vessels in the brain. Cognition and brain function can be significantly affected by the size, location, and the number of vascular changes.
Take note, symptoms of vascular dementia can begin gradually or can occur suddenly and then progress over time. It can occur alone or be a part of a different diagnosis, such as Alzheimer's disease or other forms of dementia.
When an individual is diagnosed with vascular dementia, their symptoms can be similar to symptoms of Alzheimer's. However, patients with vascular dementia almost always have abnormalities in their brains on MRI scans.
So what causes vascular dementia? Well, there are different conditions that interrupt the flow of blood and oxygen supply to the brain, which then can damage blood vessels in the brain. Can you guess what those conditions are?
Take a minute and think on it. We'll be right back after this short commercial break to discuss the causes and symptoms of vascular dementia.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.
Eat healthy and stay positive with O Snacks Omega 3. Enjoy almonds filled with vitamin E, healthy fats and fiber. Walnuts may decrease bad cholesterol, lower blood pressure and provide diabetic support. Amp up your vitamin B1 with pecans. Pumpkin seeds are rich in iron, protein, and zinc. Dried cranberries are an antioxidant, heart-healthy superfood. Boost your immunity with omega-3 mix. O-Snacks, a healthier choice.
Welcome back to the Doctor's Journal. If you're now joining us, we are talking about dementia, vascular dementia specifically.
That's right. And before the break, we promised to discuss the causes and symptoms.
Now, many of you at home may be wondering, can this be me in 10 to 20 years down the line? Medical research has advanced and continues to find more and more of what risk factors can lead to a diagnosis of vascular dementia.
That's right. But we do have a guide, as the risk factors are quite similar to that of heart disease and stroke.
Yep.
Let's look at the first and most obvious risk factor, increasing age. Your risk of vascular dementia rises as you grow older. The disorder is rare before age 65, and the risk rises substantially by your 90s.
We also know a patient's medical history can indicate a lot. So a history of heart attacks, stroke, mini strokes. If you've had a heart attack, you may be at increased risk of having blood vessel problems in your brain. The brain damage that occurs with a stroke or a mini stroke, what we doctors call transient ischemic attack or TIAs, may increase your risk of developing dementia.
Abnormal aging of blood vessels, or what we call atherosclerosis. This condition occurs when deposits of cholesterol and other substances, plaque, build up in your arteries and narrow your blood vessels. Atherosclerosis can increase your risk of vascular dementia by reducing the flow of blood that nourishes your brain. Next up, high cholesterol. Elevated levels of low-density lipoprotein, or the bad cholesterol, are associated with an increased risk of vascular dementia.
Next, we have high blood pressure. When your blood pressure is too high, it puts extra stress on your blood vessels everywhere in your body, including the brain. This increases the risk of vascular problems in the brain. Next, we have diabetes. High glucose levels damage blood vessels throughout your body. Damage in brain blood vessels can increase your risk of stroke and vascular dementia.
Very true. Next up, smoking. Smoking directly damages your blood vessels, increasing your risk of atherosclerosis and other circulatory diseases, including vascular dementia. And obesity. Being overweight is a well-known risk factor for vascular diseases in general, and therefore presumably increases your risk of vascular dementia.
And last but not least, atrial fibrillation. In this abnormal heart rhythm, the upper chambers of your heart begin to beat rapidly and irregularly, out of coordination with your heart's lower chambers. Atrial fibrillation increases your risk of stroke because it causes blood clots to form in the heart that can break off and go to your brain's blood vessels. So now that we understand the root of the disorder a bit better, let's look at some signs and symptoms you want to pay close attention to.
We must also note that there are different stages or phases to the progression of this disease. But some of the early signs include misplacing items, repetition. Is your loved one repeating stories or anecdotes quite often?
Do they have problems with language, such as finding the right word or using the wrong word? Difficulty performing tasks that are easily done, such as paying bills and stuff like that.
Trouble following instructions or learning new information and routines. Getting lost on familiar routes.
Have you also noticed changes in their sleep patterns, forgetting current or past events? Difficulty reading and writing.
What about loss of interest in things or people? Changes in personality, behavior, and mood, such as depression, agitation, and anger.
And are they experiencing hallucinations or delusions, which is believing in something that they think it's real, but it's not actually there? Poor judgment, loss of ability to perceive danger. If any of these symptoms are noticed, please get a consultation from a medical expert.
With early diagnosis and intervention, you may be able to slow the progression of the disease. Right after the break, we sit down with Dr. Pandey to give important insight on vascular dementia and what you need to know about this disorder.
Hi, good day everyone. I'm Nandini Samuel, a registered dietitian, and today we'll be speaking about the benefits of blueberries. Blueberries contain a large number of phytochemicals, including abundant anthocyanin pigments. Of the various phytochemicals, anthocyanins probably make the greatest impact of blueberry health functionality. An increasing body of evidence suggests that blueberries and anthocyanins reduce biomarkers and risk of diseases including cardiovascular disease, type 2 diabetes, and neurological decline. Blueberries improve cognitive and motor performance in tasks that engage working memory and learning. Researchers found that adding blueberries to daily diets of certain middle-aged populations may lower the chances of developing late-life dementia. Some fun ways to include blueberries in your everyday diet would be in pancakes, granola bars, overnight oats, muffins, yogurt bowls, and even as part of a healthy smoothie. Today we would be preparing a healthy yogurt bowl. We are going to use 1 cup of Greek yogurt, plain or flavored, a 1/3 cup of honey roasted granola or plain granola, 1 tablespoon of sunflower seeds, 1 tablespoon of chia seeds, and of course our blueberries. So doesn't this look great as a healthy snack mid-morning or mid-afternoon?
Sneezing, sniffling, scratching? Reacted to your favorite food? Think it might be allergies? We at Allergenics provide personalized diagnosis and treatment for food, drug, contact, and aero allergens. Call us today at 480-4362.
The best for your baby is at thebesttoys.com. From the best strollers, car seats, baby carriers, high chairs, booster seats, rockers, jumpers and bouncers, walkers, baby blankets, feeding accessories, bathtubs, gyms and playmats, playpens, cribs, baby swings, changing tables, diaper bags, clothing and accessories, and the widest range of educational toys. We carry Infantino, Dr. Brown, Avent, Graco, Chico, Fisher-Price, VTech, Leapfrog, Disney Baby, Delta Children, Medela, and Twist Shape. Visit us in-store at Forces Flagship McLean. Shop online now at thebesttoys.com. No credit card required. Free delivery throughout Trinidad and Tobago on orders over $300. Cash or links on delivery. Order via call or WhatsApp at 332-BABY. And remember, we have the best toys at the best prices.
Welcome back to the Doctor's Journal. Now, dementia is a huge topic and a disorder that has a life-changing effect, not only for the patient, but also for the family. Here with us today is a doctor who sees, knows, and understands this disorder quite intimately.
Welcome to the program, Dr. Pandey. Right, this is our consultant neurologist, and now tell us, what is your experience here with dementia in Trinidad and Tobago?
Well, an absolute pleasure to be here, and thank you for having me. And dementia is quite prevalent in Trinidad, and it's a function of an aging population. With every year, medical care gets better, and thus we expect people to live longer. Dementia is a neurodegenerative condition. So the more persons that you have living longer, the increased incidence, increased prevalence of dementia. But dementia is an all-encompassing term. There are many different types of dementia. So before we can talk about the types of dementia, we must understand what dementia is. Very often, we think dementia, and the next word that comes out of our mind is Alzheimer's dementia. But quite frankly, we have to understand that there's a difference. Dementia comes from a loss of one or more cognitive domains. Cognitive domains may include short-term memory, appropriate behavior, directions, which we call visuospatial, appropriate emotional responses in the appropriate situations, as well as different types of and different facets of memory. So you may have someone whose predominant problem is memory, and that may fit into Alzheimer's dementia. But then you may have someone who's got good memory, but they've got problems with speech. That's a different type of dementia. Then you may have someone who has problems with behavior. They may see things, but they've got intact memory. That's a different type of dementia.
So why is dementia such a growing concern for our growing population?
Mike, if you have a common cold, it's going to affect you. You're going to stay home, you're going to recuperate, you're going to go back out into the workforce. When you've got dementia, it doesn't only affect the patient, it affects the entire family. So when you've got that diagnosis, it's got ramifications for your living, for your safety, financial well-being of you and your family, for example, wills and all of these sorts of things. So dementia is important because the amount of care that goes into a patient with dementia does not involve the patient alone. It really takes the entire family. So it's very important.
So as you've mentioned that you've seen a good number of dementia patients, what is the effect that you see on these family members?
Well, you know, that's a great comment, that's a great question. Very often, the persons affected most by a patient with dementia is not the patient, it's the next of kin, it's the caregiver. And most caregivers tend to get ill or have more illness than the actual patient. Physical illness, they're actually lifting these patients, supervising these patients. They don't get time for proper meals. They don't get time to exercise. They don't get time for themselves. So it's mental health. So one of the important things that we really ought to stress when we deal with patients with dementia is not only the patient, but how is the family doing? How is the family coping? And at some point in time, have a discussion about the different types of support services that are available to families in terms of the coping mechanism.
How does one go about making a diagnosis of dementia or suspecting?
Dementia is a clinical diagnosis. We listen to the symptoms, and it's important that patients not come by themselves to the appointment, because we usually like information from the relatives, which we call collateral information. In fact, in some instances, we may do separate interviews with the patient and the relatives and subtract where the missing gaps are. We then usually do some screening questions, which may give us an idea of what type of domain is involved. The tests are really supplementary. So for example, blood tests, MRI scans, and so on. As I would have told you, dementia is a neurodegenerative condition, which means that the longer we live or the longer we have the disease, the more it's going to progress. So what we're trying to do is rule out if there is something that is correctable that is contributing to the memory problem. So is there a problem with the thyroid? Is there uncontrolled diabetes? Is there uncontrolled hypertension? Is there deficiency of vitamin B12? Are there any infections such as syphilis? All of those are contributory factors to dementia. So I'm not saying you control those things and you're going to stop your illness. It may reduce the rate of progression.
So what preventative measures, if any, would you suggest to our listening audience?
I'm going to give you the block of ice analogy here. We are born with this nice big block of ice. And it's natural with evaporation. Every year this ice is going to melt a little bit. That's normal. In someone with Alzheimer's dementia, there's a little bit of acceleration of the melting of the ice beyond what is that's right, there's a little bit more. So the ice melts a little bit more. But the vascular dementia is the ice pick. And in addition to melting, that ice pick is, so you're losing not by melting, but by actual trauma. So the diabetes, the hypertension, the high cholesterol, the smoking, the lack of exercise. Those are the ice picks, and that's preventable. My thing here is let's limit the amount of loss by preventable things. And when we speak of dementia and you have symptoms, you've missed the boat. Dementia didn't just start in the 60s and in the 70s. The loss of brain, as we can see on the screen there, happened many, many years ago in your 30s and your 40s. So you have to start by enforcing modifying the modifiable risk factors from a young age. If we look at the screen here, this here is an MRI of a normal brain. And when you look at this brain, we look at the volume, it's very good. We look at the ventricles, adequate size, and we look at the gray-white differentiation, it's fine. But when we look to the left, now that's a very drastic example, but you can see here that there's quite a lot of loss of brain tissue. The white represents scarring, and the black areas represent loss of brain tissue. So what we want to do is we want to minimize these scarring as well as loss of brain tissue and keep as much volume as possible.
You can definitely see the difference.
Oh, that's very bad. I would say that's catastrophic. But it's very good for our audience to see this, because when you're in your 20s, you're in your 30s, you're in your 40s, you want to do what you can do to prevent that. We don't want to reach that and now sitting down in the office and saying, I'm sorry, but you've got dementia, you've got vascular dementia.
So do you have any final words for us?
Well, I want to say I'm very happy with what you guys are doing, whereby you all are really trying to connect with people to impress upon them the need for a healthy lifestyle. Because what you're doing now has ramifications for a better health tomorrow. And as we said, the longer we live, the more likely we're going to get age-related illness. So I want to just say, continue what you're doing. Keep the audience on their toes. And thank you for having me.
Thank you so much for helping us out with all that useful information. And thank you for your time and your insight.
My pleasure.
Thanks so much, Dr. Pandey.
In medicine, we use many techniques to help effectively diagnose and treat your condition. One such technique is magnetic resonance imaging, commonly known as MRI. An MRI provides detailed images of the soft and bony structures inside your body, and as such, it can help diagnose certain health conditions and also rule out conditions such as tumors or growths. MRIs have other uses too. They can be used as treatment tools to help medical professionals locate injection sites or as a means for pre-surgical planning. Additionally, they can monitor the progress of a patient's treatment regime. MRIs can be most useful in helping to identify the following conditions: stroke, multiple sclerosis, spinal cord disorders, tumors, joint damage, bone infections, deep abscesses, severe muscular tears that require urgent treatment, and many more. An MRI can also be performed in addition to mammography for women with dense breast tissue or those that are at high risk of developing breast cancer. If you have an artificial joint, a pacemaker, or any type of metal in your body, you may not be a candidate for an MRI. Please contact your physician for further guidance on your eligibility.
At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure or optimize your health with one of our expert doctor consultations and diet and fitness plan. Call today at 282-2262.
Every year, over 145 million persons seek out the emergency room, most admitted due to ongoing medical conditions. Here on the Doctor's Journal, we aim to fix that by addressing the most prominent and devastating medical conditions faced right here in the Caribbean. And your product can help. If you or anyone you know has a product or service that you would like featured on the Doctor's Journal, contact us today at 266-SGPS. That's 266-7477. Or email us at marketing@sgpstudios.com.
The best birthday gifts are at thebesttoys.com. Shop for the best brands you love at the best prices. Like VTech, Leapfrog, Fisher Price, Play-Doh, Hot Wheels, Barbie, Cocomelon, LOL, Baby Alive, Crayola, Lego, Nerf, and remote control vehicles, kids learning desks and educational toys, ride-ons, bikes, drones, science toys, and board games and puzzles, and a wide range of baby items. We also have the best devices for school, like laptops, the Amazon Fire 7 tablet, the Amazon Fire 8, 10, and Kids Edition tabs, as well as cases and accessories. Visit us in-store at Forces Flagship MacBean. Shop online now at thebesttoys.com. No credit card required. Free delivery throughout Trinidad and Tobago on orders over $300. Cash or links on delivery. Order via call or WhatsApp at 32DBEST to order. And remember, we have the best toys at the best prices.
Are you looking for a customizable studio space with green and white screen cyclorama and professional production equipment to carry out your next big project? SGP Studios is the perfect fit for you. TNT's largest studio space with an overhead lighting grid and sound treated, perfect for television commercials, music videos, television programs, social media content, and film productions. We also have a wide range of production equipment available for rental. You can choose from a selection of Netflix approved cameras, modern lighting equipment, professional audio gear, 40-foot and 20-foot cranes, gimbals, drones, lenses, action cameras, and more, all at competitive prices. Whether you need a high-end cinema camera for a feature film shoot, specialized lighting equipment for a music video, or audio gear for a podcast, we've got you covered. And with our easy online booking system, you can reserve the gear you need in just a few clicks. Check us out online at sgpstudios.com.
Thank you for joining us. Earlier we shared with you the signs to look out for when identifying dementia, but we aren't really sure until a proper diagnosis is done by a trained medical professional.
That's right. And one of the tests or assessments administered by the doctor will be a mini mental state examination, also referred to as a MMSE. Here with us today is Dr. Brittany Dean, who will actually help us demonstrate the mini mental state examination to you. But for brevity, we'll only use a portion of this. Now, are you ready to begin?
Yes, I am.
So I'm going to say 3 words. I want you to remember them. Cat, car, and key. Can you recall them?
Cat, car, key.
Excellent. Now, can you tell me what year is it?
It's 2023.
And where are you now?
We're on set at the Doctor's Journal.
Excellent. Now, I'm going to show you 3 items. Tell me what they are.
Calculator, pencil, wristwatch.
Very good. Now, earlier I told you the names of 3 things. Can you recall them for me?
Cat, car, key.
Very good. And now we move on to something fun. Can you draw this for me, please?
No.
Excellent. Thanks so much for joining us, Dr. Dean.
No problem. As you can see, Dr. Dean passed the test. And as easy as you think those questions are, for those diagnosed with a form of dementia, they find it very difficult. If one of your loved ones cannot successfully complete a mini mental state examination, it is time to seek professional help where other exams can be taken.
As soon as the onset of dementia begins, it is not a matter of if, but a matter of when. When will they forget what was most important to them? When will you become a stranger to them?
We can't stop the onset, but we can manage the risk through healthy lifestyle choices. I'm Dr. Sunarine.
And I am Dr. Mike. You've been watching the Doctor's Journal. Take care now.
The Doctor's Journal was brought to you by O Snacks and Medical Associates Hospital.